Hi YouTube, it's May 10th, 2017. I'm Jeff Youmans and this is the Youmans Report. Let's talk about the news. So one of the interesting things in the news today was published by Lawrence Abrams off of bleepingcomputer.com yesterday evening, May 9th. And it's a new variant of ransomware. And as we all know, ransomware makes its way onto our computer and then starts encrypting files and then solicits money to get the code to unencrypt those files and essentially get our own data back. So if you would think about it in terms of your all of your pictures online, they could come in, totally encrypt those pictures, and then say, give me $500 or you'll never see them again. Ransomware. So the new ransomware is taking advantage of a service called Remote Desktop Protocol. So RDP, a lot of people know that as RDP, and RDP can be wide open if we're not securing it. On a personal desktop, I wouldn't worry too much about it, but on the servers, you should really pay attention and make sure that RDP is turned off, especially if you're an admin. This goes back to the ports, protocols, and services things that I've discussed in the past. And MSoft, a researcher by the name of Tuffy, found the utility and dubbed it RSAUtil, as in utility, RSAUtil. And like I said, it's coming in through RDP. The hacker is putting it on the computer and it's encrypting everything. But it's doing a couple other things too. It's making sure that your computer doesn't go to sleep. It's making sure that your system is up the entire encryption time, because if it breaks the connection, obviously it stops encrypting files and it doesn't complete its task. And then it also does things like it throws up a command prompt to clear the machine of all traces of how this happened. So it's clearing the log files. It's setting the configuration files, and it's doing the things like I mentioned before, don't sleep, all those things. So in a work environment, this is what's called a very poor security support structure. What do I mean by security support structure? I mean it's the things preventing those individual tasks from happening. If you had segregation of duties, that service wouldn't be able to go into your log files and erase all activities. Being able to erase those log files would be limited. Separation of duties, segregation of duties, same thing. With the sleep, again, those are administrative functions that should be limited, and that service should not have the ability to perform these functions that it's performing. So in a good security support structure, this attack wouldn't be successful. It would be stopped because you're limiting things inside your network. You're not just looking at the external and saying, hey, I need to fix the external. Anyway, enough on that. Next up is the Texas healthcare system settles with the Office of Civil Rights, Health and Human Services, for $2.4 million. Now, I normally don't have a problem with these guys fining folks, because normally they're wrong, and they might be wrong in this case. I don't have all of the facts. I wasn't a part of the investigation, but I want to give you all of the facts and let you comment below on what you think. So what happened was a guy came into one of Memorial Hermann Health System's hospitals, presented a fake ID, and tried to obtain services for a real problem. The police were called. The police came. The hospital cooperated with the police and told the police everything that they needed to do, or that he tried to do. And then they put out a public release statement. Now, it was the public release statement that HHS is getting up in arms about. Even though the police record would seem to be public record, even the police officer's notes, but they mentioned the gentleman's name and the PHI, or private health information, that he was seeking treatment for. So that, I mean, technically it is a violation of HIPAA security, but it was already part of public record. The hospital was just making a public statement about what happened to inform the public and keep them aware. So I'm not sure I agree with this 2.4 million. And I want to read a quote by the OCR director, Roger Servino. He said, quote, "This case reminds us that organizations can readily cooperate with law enforcement without violating HIPAA, but they must nevertheless continue to protect patient privacy when making statements to the public and elsewhere," unquote. Again, it just doesn't sit right with me in this case because it was a criminal act. We might want to look, and again, I don't have all of the facts. Let's talk about it below in the comments, okay? I'm over time today, but this one kind of tweaked me. Hope it spurred some good conversation. Take care, everybody, and have a great night.